This is a presentation of my service learning project at the York County Food Bank. There are several factors that I considered during my selection process. I wanted to participate in something that I felt a connection to, in an organization that I could personally stand behind their vision. The mission of the York County Food Bank is what caught my eye first. The York County Food Bank's mission is to end hunger in York County by working with partner agencies to increase the quantity of and dignified access to high-quality, nutritious food for everyone who needs it. I felt a personal connection with this statement. The agency selection was about more than just the mission statement. The population served was another compelling aspect. I felt that hunger is a problem that transcends all cultures and communities. It was something tangible that I could participate in. This population was living in the same town that I am. It was not on the news or somewhere that I would never go. Lastly, I wanted to participate with something that had an impact on my community locally. I wanted that personal connection that you can only get from your hometown. I travel a lot and interact with different communities through my work in several states. I did not want to participate in a national or even a state organization. Having the limitation of being in the county that I grew up in, it was a strong aspect of my agency selection. A description of the population is more of a normal stereotypical person than I originally thought. I'm embarrassed to say that I imagined that it would be homeless people and they would have poor personal grooming. That was not the case at all. The population was multifaceted. It ranged from elderly to infant. The population needed to be a York County resident. Most of the programs have a financial component related to the local poverty level. Therefore, most of the participants are poor, urban residents, but race did not seem to be a determining factor. I should add, though, that some food programs had no financial limitations. That was really surprising to me. You could be a millionaire and still come in and get food at a discounted rate. The needs of the population are diverse. Some members have a hardship that they need transitional help until they can afford food on their own. Others rely on the food supply from the food bank as their sole food source. Some are elderly that cannot get out of their house. For them specifically, there is a delivery program run by the organization to get goods to the residents. They pack boxes of food staples and deliver them to the resident. This is heavily relied upon in this population. Most of these participants cannot get out of their houses due to illness or mobility. Additionally, there are programs for nonprofits. They're able to buy food at a discounted rate to supply their organizations with food resources. Lastly, there is food offered when there is no specific need identified, just a desire of a York County resident. Identifying my role as a healthcare professional was immediately evident. Having the ability to participate in this organization allowed me, as a health professional, to have a role in addressing some issues related to food insecurity. The social aspect was identified during stocking shelves and assisting in the market. It allowed me to interact with members, to engage in conversation and general discussion. Sometimes this is the only time that the members interact with other people. I observed how family units interacted and even how strangers helped each other. One interaction that I recall was when a young Hispanic male came into the store for his first time. He did not speak any English and was hesitant to interact with me. There was an older woman in the store shopping. She came to me and said that she would take care of the boy. She went and started talking to him in Spanish, and he immediately looked more more relaxed. She had the boy follow her around, and she explained to him how it all worked. He came to the front when he was done and said thank you and left with a positive experience. I identified with this interaction related to being a professional. Often in healthcare, we are the ones that take control of situations. I had to recognize that I was not the right one for this interaction and sit back and watch. I was able to interact with the economic aspect of members when assisting in checking out purchases for non-profit organizations. I discussed with them some of the budgetary needs that they face when purchasing goods for another organization. I also was able to discuss with them the needs for medications and health checkups. I talked with them about this being an opportunity to see the community members and identify any other needs. Culturally, I was able to interact with different community members. Many were not English speaking. I was able to communicate through translation some of the healthier food choices in the store and why. I initially felt at a disadvantage to this part of the community. I remembered some of my experiences in nursing school when dealing with non-English speaking patients. They were happy to get information and were attentive to the translation. This ended up being the same type of experience. The service project was designed around the desire to achieve a complete understanding of the population as it related to food insecurity. There were 3 goals that I chose to start the work. I wanted to make sure that the goals were achievable and focused. The design was a combination of hands-on projects and identifying further initiatives to promote the organization. The organization already had an efficient system. I needed to find a way to augment it. The goals that were chosen were functional to the program. I made these happen by applying myself and immersing myself into the environment. The first goal that I chose was identifying risk factors associated with the need for food service support. This was straightforward. Performing the voluntary work, I was able to interact with the members and get first-hand information on some of the struggles and limitations of the members. Some of the risk factors were financial constraints, educational limitations, limits in transportation were all evident within this community. The second goal was to pick 3 organizations that could donate food to the food bank. This ended up being a more difficult goal, but was worth the extra work. I had to really look at how they were soliciting companies and what their goal was. I spoke to a local Chipotle that was already providing some food. I spoke with them about the need for more healthy choices, and if possible, could they look at donating more vegetables and meats versus fried foods. Another organization was identified when picking up donations. I spoke to the individuals at the Internal Revenue Service about what they donated. I offered some suggestions that would be healthier options versus desserts and high sugar items. I tried to promote more fruits and vegetables. The company was very receptive. They confided in me that they did not know what to donate. I told them that anything will help, that this food is going directly to the shelves to be given out. I think that this really made a more personable connection to the staff and hopefully will increase their participation. The third organization was a small business at a local market. They sell fresh produce. I discussed with them the local need for fresh produce and the limited supply. I asked them what they did with their waste. I spoke to them about potentially donating it to the food bank. It could be a tax deduction, and instead of food being thrown out, it could be resourced. They were excited to have a full circle system limiting their waste. The third goal was to participate in 3 pop-up markets. The pop-up market was a function of the food bank that set up a stand to deliver groceries to local residents 2 times a week. Being able to participate in 3 of these market events allowed me to interact with a higher volume of residents in a different environment. I was able to discuss with them healthier food choices and how to overcome some common barriers that they face, like potentially carpooling or using public transit system to get back and forth from the market. Also to tell their neighbors and friends of the resources available to them. The project, I felt, went well and hit the overall goal, although if I would do it again, I would change the number of pop-up market participations. Prior to volunteering, I did not realize how much more interaction I would get participating in this aspect of the food bank. Secondly, I did not realize how much nutritional education is needed in this population. Most of the population did not understand sugar and fat content compared to healthier choices. If I would do it again, I would focus more on nutrition, education, and food selection. Did I make a difference with my learning project? Overall, I think I did have an impact on the organism and the population. For the most part, the residents were open to the conversation and looked for any guidance that related to the food selection and options. There became regulars that I would see, and they would comment on what they chose when I was not there and how they were eating healthier. I also feel that there was a positive impact on the employees at the food bank. They looked for education on healthier food options when available. The additional food that will come from the new organizations will have a positive impact on the food supply at the food bank. Taking time to reflect on this experience is just as important as participating in it. If I did not reflect upon it, I would not be able to learn as much and be a better provider and person. The project had a positive impact on me personally. I feel like I was useful to the organization and the population. I was able to reflect on some of my hardships and found inspiration in how the residents remained positive even when it was not going their way. Professionally, I also think that I had a positive experience. It gave me more background on the population. I see these same individuals in healthcare, and sometimes I'm not empathetic to their food insecurities. This experience allowed me to be more positive and remember that there are all types of different people, and not everyone has the same experiences and opportunities that I do. In summary, I chose to discuss food bank insecurities as my service learning project. I developed 3 goals to help facilitate a better understanding and identified ways to improve the current system at the York County Food Bank. I will continue to volunteer and look forward to more positive experiences. Thank you.